Hi, good morning Heath. My name is Lucas. I'm your invigilator for the OET speaking session conducting on the 18th of January 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you say your full name for the record, please?
My full name is Heath Hemsworth.
And what is your candidate number, please?
My candidate number is 213264532.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
How do you address questions from a patient's family and friends?
I lead with empathy. I know that I need to give them the best information that I can. However, I try to make sure that I'm answering them in kind ways, and I imagine myself in their shoes. Now, I know that I can't answer all of their questions, so I try to set boundaries and make sure I'm not enabling, either.
Can you explain situations without using a lot of medical jargon? Give an example.
I have various patients with different educational backgrounds and ages, so I must break medical jargon down into understandable ways. For example, whenever a doctor orders radiology for a patient, I make sure that I explain to the patient they are getting an X-ray. Also, I try to make sure the patient understands by asking them to repeat what they think they heard. That way, everybody is on the same page.
What is your idea of effective patient and family education?
Effective patient education centers around the patient and family's needs. You have to understand their learning style and adapt accordingly. For example, some patients prefer reading medical instructions versus watching a DVD. You also need to figure out what each patient needs. Some want detailed information. Others just want the necessary information. Including the family in the treatment process is crucial because they may end up serving as primary caretakers for the patient going forward. Show them how vital they are to the process and key them in on how they can help.
Many times, when people hear the word addiction, they think of the abuse of prescription drugs. What are some other addictions you have worked with?
I have worked with people who have battled several different addictions. One common addiction that many people are not familiar with is food addiction. Unfortunately, it is almost as difficult to overcome that addiction as it is to overcome substances such as meth. Additionally, many people who are overcoming substance addictions often develop food addiction as a way of coping with their craving for drugs.
What is one of your weaknesses and what do you do to help address or resolve it?
My biggest weakness has to be that I take on too many projects at once. While being involved and participating in various things is fun and can be good for a person, I tend to take on several things and then leave some projects unfinished. I have begun to limit myself to only taking on a few projects at a time so that I can devote the necessary time to staying on task.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients or perhaps a relative and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you.
Excuse me. May I know the mother's name, please?
You can call her Chinda, Lucas.
All right. Thank you.
No worries. You may continue your preparation. Your preparation time is over. You can now start the role play. Don't worry if I stop you when the time is up.
Hello, good morning, Chinda. I'm your nurse, Keith Hemsworth, here for you. Well, how are you and your baby?
Hi, good morning. We both are doing great, nurse. Thank you for asking.
I'm very glad to hear that. Chinda, did the baby feed well?
No. Unfortunately, the baby is not being well breastfeeded. He is sleepy too.
Oh. I see. Let me examine him once.
Sure.
From my assessment, it might be due to jaundice. I really suggest having a blood test for the baby.
Nurse, is it possible for us to go home today?
With the actual plan, you both were meant to go home today. Perhaps, I prefer you to stay in the hospital until the blood results are ready.
Oh, nurse, are you asking me to stay back in the hospital? My God. My sleep is disturbed since the date of admission in the hospital. And I wish to be home, rather than being here in the hospital.
I am sorry, Chinda. The level of bilirubin in the baby's blood will need to be tested. The level of bilirubin detected in your baby's blood is used to decide whether any treatment is needed. Hence, I suggest you stay here until the blood results are ready.
Nurse, can you share some piece of information about jaundice, please? Also, how is it caused?
Definitely. I always welcome the opportunity to share knowledge on my patient's health condition to each of them, so that they have a better understanding. I will provide a brief on jaundice for you.
Great, thank you.
Jaundice is a condition caused by too much bilirubin in the blood. This is also known as hyperbilirubinemia. Bilirubin is a yellow substance, produced when red blood cells, which carry oxygen around the body, are broken down. The bilirubin travels in the bloodstream to the liver. The liver changes the form of the bilirubin, so it can be passed out of the body in poo. But, if there's too much bilirubin in the blood, or the liver can't get rid of it, the excess bilirubin causes jaundice. Is it clear for you, Chinda?
Yes, I am. Thank you, nurse.
By the way, don't panic. Jaundice is common in newborn babies, because babies have a high number of red blood cells in their blood, which are broken down and replaced frequently. A newborn baby's liver isn't fully developed, so it's less effective at processing the bilirubin and removing it from the blood.
Nurse, one of my friends, whose baby was jaundiced, did not need to stay in hospital for treatment.
As I mentioned, jaundice is one of the most common conditions that can affect newborn babies. It is estimated 6 out of every 10 babies develop jaundice. But only around 1 in 20 babies has a blood bilirubin level high enough to need treatment. Hence a blood test is necessary to diagnose whether the treatment is necessary or not.
Okay. I understand now.
For your better understanding, if a baby with very high levels of bilirubin is not treated, there's a risk they could develop permanent brain damage, which is very rare too.
What are the treatment options, nurse? I'm very much concerned that there are any side effects for the treatment.
Don't worry, I can explain it to you. There are two main treatments that can be carried out in hospital to quickly reduce your baby's bilirubin levels. The first one is a phototherapy, a special type of light shines on the skin, which alters the bilirubin into a form that can be more easily broken down by the liver. Am I clear?
Oh, yes.
Good. And the second treatment option is exchange transfusion, where your baby's blood is removed using a thin tube, catheter, placed in their blood vessels, and replaced with blood from a matching donor. Most babies respond well to treatment, and can leave hospital after a few days. Do you understand?
Yeah, I do understand, nurse.
Also, these two treatments did not possess any side effects, or did not require any permanent medications.
All right, nurse.
So, kindly be patient. Stay here in the hospital till the blood results are ready.
All right, nurse. Thank you for your information and willingness to explain it to me.
I appreciate your kindness. It's my responsibility to keep the patient worryless and informed. I wish you and baby a healthy life ahead.
Thank you, nurse.
You are welcome.
That is the end of your OIT speaking role play. All the very best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.